The lower leg is made up of the patella, tibia, fibula, and the foot. The tibia is the main bone of the leg, forming what is more commonly known as the shin. At the proximal end, the tibia is widened by the medial and lateral condyles, aiding in weight bearing. On the anterior surface of the proximal tibia, inferior to the condyles, the tibial tuberosity is situated. This is where the patella ligament attaches, and if you have ever had Osgood slatters, you will know all about it. Anteriorly, the shaft of the tibia has an anterior crest. The start of the anterior crest is marked by the tibial tuberosity. It is palpable down the anterior surface of the leg as the shin. The distal end of the tibia, like the proximal, widens to help with weight bearing. There is a bony projection continuing inferiorly on the medial side. This is called the medial malleolus. It articulates with the tarsal bones to form part of the ankle joint. The fibula, along with the tibia, makes up the bones of the leg. The fibula is found laterally to the tibia and is much thinner. As it does not articulate with the femur at the knee joint, its main function is to act as an attachment for muscles and not as a weight bearer. At the proximal end, the fibula has an enlarged head, which contains a facet for articulation with the lateral condyle of the tibia. On the lateral side is a thick and rough prominence, the styloid process, which projects upward from the posterior part of the head. Distally, we can see the lateral malleolus. The lateral malleolus is more prominent than the medial malleolus and can be palpated at the ankle on the lateral side of the leg. The patella has a triangular shape with anterior and posterior surfaces. The apex of the patella is situated inferiorly and is connected to the tibial tuberosity by the patella ligament. The base forms the superior aspect of the bone. The posterior surface of the patella articulates with the femur and is marked by two facets. The medial facet articulates with the medial condyle of the femur, and the lateral facet articulates with the lateral condyle of the femur. The patella has two main functions. Firstly, leg extension. It enhances the leverage that the quadriceps tendon can exert on the femur, increasing the efficiency of the muscle. It also aids in protection, to protect the anterior aspect of the knee joint from physical trauma. You must be able to determine if a patella is a left or right. If you face the apex away from you and let the patella lie naturally, it will tip to the side of the body that it is from. This is due to the fact that the lateral facet is larger than the medial. So this is a left patella. The human foot is a very complex and highly developed structure. The bones of the foot provide mechanical support for the soft tissues, helping the foot withstand the weight of the body. The bones of the foot can be divided into three categories: tarsals, metatarsals, and phalanges. The tarsals are a set of 7 irregularly shaped bones. They are situated proximally in the foot in the ankle area. The metatarsals are the bones that connect the phalanges to the tarsals. There are 5 in number, 1 for each digit. The phalanges are the bones of the toes. Each toe has 3 phalanges, a proximal, intermediate, and distal, except for the big toe, which has only 2 phalanges. The tarsal bones of the foot are organised into 3 rows: proximal, intermediate, and distal. The proximal tarsal bones are the talus and the calcaneus. They form the bony framework around the proximal ankle and heel area. The talus is the most superior of the tarsal bones. The main function of the talus is to transmit forces from the tibia to the heel bone, the calcaneus. Whilst numerous ligaments attach to the talus, it is not a site of muscle attachment or origin. The calcaneus lies underneath the talus. It is thick and sturdy, acting to transmit forces from the talus to the ground. The posterior aspect of the calcaneus is where the Achilles tendon attaches. The intermediate row of tarsal bones contains one bone, the navicular, given its name because it's shaped like a boat. It articulates with the talus posteriorly, the cuneiform bones anteriorly, and the cuboid bone laterally. In the distal row, there are 4 tarsal bones, as pointed out, the cuboid and the 3 cuneiforms. The cuboid is the most lateral bone in the distal row, articulating with the calcaneus posteriorly and 2 metatarsals anteriorly. As its name suggests, it's shaped like a cube. The 3 cuneiforms, lateral, intermediate and medial, are wedge-shaped bones. They articulate with the navicular posteriorly and the metatarsals anteriorly. The metatarsals are located in the midfoot, between the tarsals and phalanges. They are numbered 1 to 5, medial to lateral. Each metatarsal has a similar structure. They consist of a distal head and proximal base, which are joined by a shaft of bone. The phalanges are the bones of the toes. Most toes have 3 phalanges, proximal, intermediate and distal. The great toe only has proximal and distal phalanges.